To get the most out of this pandemic, respiratory health is very important in COVID-19 period. The coronavirus is a virus that attacks the lungs, and therefore it is essential to care for and protect these organs. SARS-CoV-2 is the coronavirus behind the current pandemic. Since this virus mainly affects our lungs, caring for our respiratory health in COVID-19 has become an important medical necessity. We know that this virus enters the body through respiratory droplets from infected individuals. The coronavirus is carried inside these droplets that serve as an aerosol and spread to the respiratory system of a new host. Droplets can also descend to a surface where others can touch and become infected. When the virus reaches the respirator, SARS-CoV-2 settles in the alveoli where the lungs cause the most damage. There, it produces symptoms we already know, such as swelling and fever, cough, fatigue and shortness of breath. Taking care of respiratory health is one of the main measures during the COVID-19 pandemic, because not everyone suffers from this infection in the same way. Some people experience severe forms of this lung disease that force them to be hospitalized in intensive care. If the support measures fail, they should be connected to artificial respiration devices. Among the groups at risk of developing severe forms of coronavirus are those with chronic respiratory disease. An example of this group is people with asthma and those suffering from chronic obstructive pulmonary disease (COPD). We can also include smokers among the most sensitive. Respiratory health in COPD patients during COVID-19 COPD, i.e. chronic obstructive pulmonary disease, covers pathologies such as asthma, chronic bronchitis, emphysema, and atelectasis, collapsed lung. All this has one thing in common: the obstruction of the air passage in the bronchi. A patient with COPD usually has to take medications that allow the bronchial tubes to open more. Sometimes they need daily medications, sometimes they only take medicines in acute crises. The most serious cases require getting oxygen almost all day or just at night. It is extremely logical to assume that patients with these features are more vulnerable to the existing pandemic. SARS-CoV-2 infection can cause exacerbation of conditions and an increased risk of needing hospitalization. Respiratory health of COPD patients is more important than ever during COVID-19. If the virus sticks to already damaged lung tissue, it can cause more damage than expected. COPD patients have major disadvantages in case of hospitalization and need for respiratory support. The bronchial tubes are reactive and allow less air to pass, reducing the amount of oxygen in their body. This risk group should pay close attention to habits. First, it is very important that they do not stop taking medication without consulting a doctor. And it is extremely important that they respect social distance regulations. If COPD patients experience any signs of coronavirus, they should consult a doctor immediately. Follow the instructions given by your local authorities and avoid seeking medical advice before contacting by phone. The danger of using tobacco during the current outbreak. Tobacco is a very strong toxic agent that has functions against our respiratory health. It can affect the cleaning mechanism of cells in the mucous membrane of the respiratory system. Therefore, it reduces a person's natural defense. Our previous experience with the H1N1 flu pandemic allowed scientists to investigate the effect of tobacco on smoking patients. In doing so, they discovered a strong relationship between the act of smoking and the risk of suffering from this flu. When it comes to the current coronavirus, we have no choice but to assume that the effects of tobacco are similar. Smokers should reduce the amount they use, or better yet, use this time to quit smoking completely. Although the isolation process is stressful and leads to more tobacco consumption, it is very important for people to strive to resist the desire to smoke. Respiratory diseases not caused by coronavirus. While COVID-19 may seem like the only disease that currently exists, the opposite is true. We must remember that other diseases, including respiratory diseases, still exist. People still suffer from colds, sinus infections, acute bronchitis, nasal allergies and similar problems. When in doubt, it is important to consult a doctor to distinguish symptoms. At the same time, avoid self-deciding drugs at this time. Avoid drugs that have increased from the other times when you or a person in your home experience one of these diseases. It will be important to remain careful even when the authorities find it safe to leave our homes and remove quarantine restrictions. When people begin to act with relative normality, all these respiratory diseases will also improve circulation. It is important that we adopt good hygiene practices until our habits become closed habits. These include washing our hands, using the inside of your elbow when sneezing and coughing, and protecting your distance if you have symptoms. Respiratory health requires commitment during COVID-19 period. One of the things we continue to hear during this epidemic is that being attentive is a shared responsibility. The same is true when it comes to respiratory health in COVID-19 times. It will not be enough for patients with COPD to take responsibility, but the whole global community must do so. Groups at risk need everyone's common sense and thoughtfulness to prevent the spread of coronavirus. And finally, you can support the video by following us smiley face.